Thank you for staying with us. This first leg of the conversation is about our health. We hinted you earlier today, as it is commemorated the World 8th day, 1st of December, every year rather. And the conversation this morning is to look into the importance of this commemoration and, of course, the theme put together for this year, talking about overcoming disruption, transforming the AIDS response, and we are narrowing it down. So in Osun and in Nigeria, when you talk about HIV/AIDS, like 15, 20 years ago, it used to be a dreaded thing that many persons, will shiver. There are myths, there are misconceptions about it. But right now, it seems that conversation has gone down. That awareness has gone down. I beg to say there might be some persons who are of the opinion that there is no more HIV. And so we need to have that conversation. Why has that messaging gone down? Are people still, presenting for testing? Do we still have, people who are HIV carriers? Is it still prevalent? We narrow it down to the Nigerian conversation and the Osun conversation as far as today, World AIDS Day 2025 is concerned. A statement from the WHO, that's the World Health Organization, says the organization joins partners and communities to commemorate World AIDS Day 2025 under the theme Overcoming Disruption, Transforming the AIDS Response, calling for sustained political leadership, international cooperation, and human rights-centered approaches to end AIDS by 2030. And 2030 is still 5 years away, in fact, less than 5 years away. If you ask me, after decades of progress, the HIV response stands at a crossroads. Life-saving services have been disrupted and many communities face heightened risk and vulnerabilities. Yet, amid these challenges, hope endures in the determination, resilience, and innovation of communities who strive to end AIDS. And there are some figures given. Actually, in 2024, an estimated 40.8 million people were living with HIV globally, and approximately 630,000 people died from HIV-related causes in 2024. An estimated 1.3 million people acquired HIV in 2024. These are information, from the WHO website talking about today. We have someone who works in that sector, is passionate about anything that has to do with the young people, with the youth. And of course, he is the president of Garnet Youth Development Foundation, Mr. Omole. Thank you for joining us.
It's my pleasure to be here once again.
It's good to have you here again, Mr. Omole. Now, last year you were here as well, talking about this conversation, and the year before as well. And these are, the information I read out is on the WHO website, and it's quite frightening to hear that globally an estimated 1.3 million people acquired HIV in 2024. So acquiring the HIV, 1.3 million people. So it's safe to say these 1.3 million people are threats to maybe other 1.3 million people or more than that globally now. Is it as prevalent as the WHO has put it in Nigeria, or the situation is even worse?
Thank you very much. Thanks for inviting me once again. I want to say a very big thank you to this organization for actually trying as much as possible to reach out to the people on this subject matter. Yes, it's actually as worse. Back to your question, as worse as it's reflected on that statistics, and it might even be much more. Because what we have around us now, we keep telling people, like you said earlier, that people still have their doubt that HIV is still existing. I think that's where we're actually getting it all wrong these days. People just assume that it has gone. Even the awareness around hepatitis is much more than HIV these days. That's one of the key challenges we have been having.
What's the response?
And when I came here last year, I highlighted quite a lot of things, and I talked about the insensitivity on the part of new media Nobody is actually in charge of new media to channel this cost. Then in terms of resources too, most people are leveraging their resources on something else. I mean, in most of the states, where way back then you realize that it was actually the states that do facilitate most of the awareness creation activities and what of even anything they get from development partners. They are just to complement whatever activities they are. So it's like everybody has taken the backseat. Then in most cases, the leadership around HIV response has been more of a political leadership than competence. And we are not really getting it right there. And when you put a round peg in the square hole, there's every tendency that it's not going to fit in. So that's what we're facing locally around the HIV response. And then we are mainly depending on donor funding, which is not as consistent
as a nation or as a state, or both?
Everybody, as a nation and as a state. And you can see the theme we have for the year, overcoming disruption. There has been disruption. You know, when I came here online the other time, when we were talking about something else regarding economy, we were saying that most of the donors, they are really going back. Most of the USAID projects, they have closed out. Most of the development partners that have been supporting HIV programs, they are. So, you know, if you look at the theme for this year, they are actually talking about the response. They want us to localize the response. They want us to, because we have, the response has always been dependent on what they are bringing to the table. And most times, those people, he who pay the piper actually dictate the tune. They will tell you how you want to spend your money. But we know where shoe actually pinches us. And we know how we can tackle our issues. The way we are going to tackle HIV response in Osun State might be different from the way you are going to approach it.
Mr. Omole, in the past, when the messaging was heavy, I remember there were radio dramas.
Yes, yes.
There was a need to know on many networks.
Yes,
you know, all of these sugar. I remember a continental series at that time. Remember sugar?
Yes.
Talking about HIV and young people, the need for prevention, and you know, even when anybody has contacted you, how to manage it and all of those things. These development partners, they still dictated how we spend that money at that time. So how has it become a problem now?
And at some point, you know, most of our people, they didn't really do well too. You know, when they have access to resources to work on HIV and AIDS and so many other things, they personalize it. And at the same time...
You're alleging corruption there?
Yes, definitely. In all sectors, high level of corruption. I remember when we were doing Global Fund projects. Global Fund projects meant to work on AIDS, tuberculosis, and malaria. When they first started, they give money indiscriminately. They give you resources. You can work with anything. And they realized that there is high-level, heavy corruption in the chain. So now they shifted their focus. They said, okay, if you want to, back then, if they want to give you money, they can give you in cash. They can do some things for you. They can give you money and go and implement. But now we monitor their last 1 era, where it's going to. So I think
if they are monitoring, that should not be a problem, isn't it?
And they are monitoring.
If I've come to you with a proposal and I said, my people need this, and you said, okay, I'm going to support you, or you are going to monitor me, in as much my motive and intention is right, I should have no problem.
But you know where the issue is that if I tell you that I'm coming to this station now and I'm spending like 1 million naira to talk to you guys, you know, the impact might not be directly measured. To track my resources. I might come here, and my coming here might not really make all the necessary impacts that I wanted to make. This strategic behavioral change might not happen. But it's going to be captured that I came to your station and you have taken 1 billion naira. But if I'm taking care of, because I'm looking at the entrepreneurship mindset of those people that are coming around. If they say that they are procuring 1,000 ARV medication for HIV and 1,000 people are taking it, over this, you know, I can track that money. I can track the amount of drugs I procure, which I'm going to ship in. I can track the number of people that are taking it. I can track how much they have taken, then what is left. And there are so many MIE, but whether you like it or not, they are the one paying us, and they have their vested interest too. The political international political whatever play out when it comes to this thing. That's why it is very important for us to look forward, mobilize resources ourselves. Then capacity development should be encouraged among all the stakeholders implementing HIV-related issues in our locality.
All right, Mr. Omole, Nigeria still accounts for one of the highest, HIV burdens globally. Let's look at what this report that was released by UNAIDS, on 25 November, where it says here that the global response to HIV has suffered its most significant setback in decades. That was a warning release, and it said details the far-reaching consequences of international funding reductions and lack of global solidarity, which has sent shockwaves through low and middle-income countries heavily affected by HIV. So there has been abrupt reductions in international HIV assistance in 2025, which have deepened existing funding shortfalls. So there has been, before this year, there has been an existing funding shortfall. You've made mention of some. But how much of this, how much of the, us accounting for the highest, of this burden globally, how much of it, rests on this recent funding, cut, and how much of it rests on the inefficiency of our own governance? The inadequacy in our governance.
Thank you very much. Let me shock you. In this space now, as it is now, okay, we just had a conversation earlier that it's like there's nothing happening around. Most of the funding, they were focusing much on treatment.
Okay.
In the last 3, 4, 5 years, they have been focusing much on treatment. They said that if you get people treated, and they feel that there's prevention in treatment. Because if I get it treated to some extent, and then if I get it treated, it comes to a stage that we call it zero prevalence, where it's not significant in your blood. So the HIV is still there, but you can't infect any other person, and it takes time. It depends on how much you adhere to your medication. So one can
actually, a carrier can actually get there?
Yeah, somebody living with HIV can get there if you discover before it's become full-blown AIDS, and then you actually take your medication as all the therapy you are doing it gets to a level that you won't feel it again. So they feel that by the time they start taking care of people that are HIV positive, then they can do, that's their logic. But they have forgotten that in this space, and we leverage on local communication and so many other things. And the issue around hearing things over and over again, and you internalize it and it's become part of you, maybe they have forgotten that aspect. That's why they are not really doing what they were supposed to do. And the reality now in Osun State is that the last partner that is supporting HIV/AIDS response in Osun State might leave first quarter of next year. And Osun State does not have any budget dedicated to HIV.
Even at the ministry level? At
the ministry level, they don't really have anything they have. Even if they have the budget, there are no resources, there are no approval for it. And
so you've been relying solely on external...
And the agency that is saddled with the local community response is meant to be an Osaka. And so far, they have been incapacitated in so many ways. In terms of leadership of the agency, in terms of the resources available at their disposal, in terms of the technical know-how of the agency. And all these things combined together for us to actually have a synergized response to HIV, because they are dealing with the community response, while the SAPC, the State AIDS Prevention and Control and Coordination Entity, is actually dealing with the healthcare response. But they work at crossroads at some point. But as of today, it's like Osun is sitting on the keg of a gunpowder. No critical issues around us. The leadership is not there. The political will is not there, which is the function of the leadership. And at the same time, there are no resources dedicated. And if USAID is not giving us support again, the leadership can come up with an initiative. They can leverage with partner with private sector. They can do a lot of things. I realized that one of the biggest health complex in Osun State is being built by an individual, a woman, for us, for Osun Teaching Hospital. Why can't we do something like that around HIV and AIDS response? Why can't we go out there? We have so many Osun people that really want to help us. And if you are not infected today, one way or the other, you are affected. Because it's going to cause a strain on your healthcare service provider when you are supposed to go there for malaria treatment and some other things. The resources to manage, there's nothing free under the earth. The ARV that they are giving people for free, as long as those people withdraw their money and everything, it will take billions of naira to actually procure all those things to keep over 30,000 people that are living with HIV/AIDS in Osun State. And you know, the statistic of NIAS 2018 make us realize that Osun State's HIV population, we still have about over 20,000 people that have not known their status, that have not been tested, and that have not been placed on treatment. So it's not something, and you know what one person can do in the population, and our population is about 5 million. And the prevalence in Osun State is 0.9% compared to the total population, which is about
0.9% of the population.
Yes, yes, because we have 5
That's
million
almost
people.
1%.
Yes, yeah, that's almost 1%. So we're talking about 50,000 people here walking around. We still have like 20,000 that have not known their HIV status, but they are living with HIV according to the statistics.
You know, because of time and all of those things, you have identified some of these issues. What should we be doing right now? Let's talk about the solution.
Right now, number one thing we should be doing is that government should declare a state of emergency around the response to HIV and AIDS in Osun State.
Is it an emergency?
It's an emergency.
But some will say there are maybe other brutal diseases like hepatitis, like the COVID, like all of those things.
Do you know? Do you know why hepatitis is not brutal? Is because if you get infected and you got to know early, you can be treated and you can be cured.
Yeah.
HIV does not have cure. They are spread through the same route.
But people argue that it kills faster.
HIV positive. When someone is HIV positive and is hepatitis positive too, around a bomb lower.
So what should we be doing?
Now, number one thing we should be doing is that there should be a kind of rejuvenation of the system that is actually coordinating the HIV response in Osun State. They need to be much more inspired one. Then they need to be up on their toes and really know the subject at the matter at hand. That is not something that we play politics with, or it's not something that we go all the way out there. And the structure that is doing these things should be reformed. I mean, the leadership of HIV response at the community level and at the health level. At the same time, we should be intentional about resource mobilization for HIV and AIDS response. What I mean that being intentional is that we can do resource mobilization. We have so many contractors. They can set up a trust fund for HIV and AIDS in Osun State. We can partner, go out there, go to international conferences are coming. There is one coming in this December in Ghana for ICASA. There's another one coming next year in Brazil. You go there, you sponsor people, you negotiate, you tell them what your challenges are. How can they help us? Osun State can be producing their own medication on ARV if they have good partnership, which they have started doing. But then all you media houses that are doing things for us for free, now, because you take it as part of your corporate social responsibility, it should be encouraged. There should be finances so that you can help us to disseminate that information at the grassroots level, at the top level.
Time is really of essence this morning, and we have to go on our break. Actually,
so much.
But I like to, maybe as your parting shot, because there are many persons who are watching you are saying, it's not happening. It's no more. I'd like you to give the proper message in this morning to everybody watching you.
All right. Thank you very much.
Is it still existing?
Yes.
Is it still real?
Yes.
How bad is it?
HIV is still
Give it the
very,
next
very
30
much.
seconds to do.
HIV is very much real in our society, and it is very important for all of us to come together. Let's face the reality. Let's support those people living with HIV. Let's support information around HIV and try to disseminate it in our own little way, in our own space. Be it religious, be it media houses, be it young organization, anywhere, community leaders. We can push out that information out there. It's still very real, and people are still dying daily due to HIV and AIDS. And I believe strongly that with all of us coming together, we'll see to the end of HIV in 2030.
You believe that goal?
Yes, it's something that is
the WHO goal of ending HIV by 2030.
Yes, it's not
even with our reality in Nigeria.
Yes, you know, there are still so many research
5 years
ongoing
away. Yeah.
that they are working on. And you know, UNAIDS said they want us to, the goal is 95, 95, 95.
Yes.
That's anybody that is living with HIV and AIDS, they must know their status. 95% of those people that know their status, they must have been placed on treatment. 95% of those that have been placed on treatment, they must have experienced immunosuppression for HIV.
Yeah.
All right. So
thank you. Youth Enthusiast, the executive president for Garnet Youth Development Foundation. Thank you very much for your time and take and for every messaging you have dropped this morning. And of course, it's part of our corporate social responsibility to be part of this messaging as well, to tell you that HIV is still real. Things that are happening. Social media, TikTok hasn't taken it away. In fact, all of those platforms should be used to disseminate it. Yes. You know, abstain